And we're happy to be joined by Dr. Shephali Wulff, infectious diseases physician and systems director for infectious diseases for SSM Health. And Dr. Wulff, let's just start there. Health officials have been expressing concerns about COVID cases breaking out at the Olympics. The idea it could be a super spreader event. Organizers have already banned spectators. There's all these extremely cautious protocols in place, and yet they still have positive cases before the opening ceremony inside the bubble. So I guess my concerns are, is it even possible to do the Olympics under these conditions, or is this just the reality of what we're going to live with this virus from now on?
Well, I think the Olympics poses a particular challenge because we have many people coming from all over the world, and we know that most of the world is largely unvaccinated. And we also know that COVID is spreading very quickly, kind of all over the world. And so when you have people traveling from far corners of the planet and congregating in one space, I think it was just a matter of time before they saw a COVID case. And so my hope is that with the containment measures they have in place, we don't see a lot of spread in the Olympic Village, but I'm not terribly surprised that they have their first positive case.
You know, what we're seeing right now across the country is kind of what we feared, but a month after lifting virtually all COVID restrictions on businesses and other public spaces, LA County is now going to require its residents to wear masks inside public spaces, regardless of whether you're vaccinated, and that starts tonight. Las Vegas is now recommending it. They're not requiring it. But this does run contrary to CDC guidance right now, saying that, hey, if you're vaccinated, you don't have to wear a mask. The only risk is posed to the unvaccinated. What can you tell us right now about this mixed messaging? And are you worried right now about things like mask fatigue? Again, vaccine hesitancy.
So I want to be careful because the CDC from the very beginning has said that people who are vaccinated can be safe to not mask. But they also said in their guidance that people who are vaccinated should consider wearing a mask if they're in places where a lot of people might be unvaccinated. And I think that's what we're seeing across the country, is that when we look at the reasons for why we might be seeing this new wave of COVID infections, I think it really boils down to three things. So it's one, a loosening of the mask use across the country as people started to see lower infection rates in their communities. People got comfortable not wearing masks anymore, especially as the weather got nicer and people resumed travel and gathering with their family and friends. And then two, this rapid rise of the new Delta variant, which we know is more contagious. And then finally, this low vaccination rate in most of our country. And so when you pair all of those things together, that's really the reason that we're starting to see these surges in COVID infections. And so if you're in a let's say if you're where I am in Missouri, we as a state are about 40% fully vaccinated. And so if I were to go to the grocery store, even though I'm fully vaccinated, the majority of people who are around me are not vaccinated. And so that really does pose a risk to everyone around me. And because we're not asking for vaccine passports or proof of immunity, we really have no idea who around us is not vaccinated.
Yeah, very different vaccination picture there than in New York or in D.C. where I live. Doc, President Biden says platforms like Facebook are literally killing people by allowing COVID-19 misinformation on their services. Dr. Fauci doubled down on part of that statement. I want to play for you what he said.
The only thing I can say is just to underscore what Surgeon General Vivek Murthy said, and that is misinformation in so many respects is really resulting in killing people. I mean, you get misinformation out there. I mean, I have heard people who call me, who I get involved in interviews with, who think things about vaccines that make absolutely no sense. And when that information or misinformation and disinformation gets propagated, the bottom line and the tragic part of it is that that can cause lives.
Facebook has responded by saying, in fact, that they're helping to save lives by promoting factual COVID information. But I'm curious what your take is on this. How dangerous are some of the lies that are out there on social media?
They're extremely dangerous. And I think what's so difficult about the misinformation that's out there is that some of it's very clever, and it starts with a partial truth. And then it builds on that partial truth and takes people down this rabbit hole that can be really hard to undo. And so I think the misinformation is extremely dangerous. I can't agree more with what the Surgeon General said the other day. And we're seeing it in our own healthcare system. what I would love to see happen is really a better partnership between public health, health systems, businesses, and media to really work together to combat some of the misinformation that's out there. And I think what we need to be realistic about is that when we talk about vaccines of any kind, without a mandate, I'm not convinced that we're going to get beyond 65 or 70%. And so I'd really love to see better partnership between those groups of people to, one, try to combat the misinformation out there, but then also to send a consistent message about what the best mitigation practices are. Masking, social distancing, because I think all of us who are trying to spread truth and science need to be unified in the message.
Consistent messaging has been a problem from the word go on all of this. Dr. Wulff, thank you for your time.